Welcome to this session titled COVID Response Session, Going Virtual with the Maternal Telehealth Access Project. It's a little bit of a misnomer for this session, but it is the one thread that links all of our presenters together. My name is Allison George. I am a curriculum development specialist at the Maternal Health Learning and Innovation Center. I will be moderating today, mostly just helping our presenters highlight the great work that they do. The one common thread that brings us all together, besides our interest in maternal health, is participation in the Maternal Telehealth Access Project, or MTAP, which was funded in May of 2020 for 1 year by the CARES Act to increase access to quality maternity care and services via telehealth during and beyond COVID-19. The project focused specifically on serving women at greatest risk of maternal mortality and morbidity, including women of color, Black women, Native American women, Latinx women, and women who live in rural and frontier counties. Each of the presenters today received funding through that program, and that is how UNC and the Maternal Health Learning and Innovation Center learned about the great work that they're doing, and we're really excited to have them back today to tell us what they've been doing since, what's on their mind, and to inspire our audience to also get involved. I will briefly introduce the faces on the screen today and then hand it over to each of them to tell you more about the work that they are doing. And I'm very excited to sit back and watch you all let us know what we need to know. So first off, we have Dr. Juan Michelle Martin, who's a licensed physical therapist, birth doula, and reproductive wellness coach. She is the owner of JMM Health Solutions, which is a concierge pelvic health practice in the Atlanta metro area, where she brings 14 years of clinical experience as a physical therapist. Dr. Martin, or Dr. J, as she prefers to be called, has worked with thousands of patients in her career with a focus on providing holistic and comprehensive pelvic health care. She blends her experience as a birth doula and wellness coach in her practice to ensure that women experience better birth outcomes. And she continues to work with several nonprofit organizations whose mission is to decrease maternal mortality rates in marginalized communities. Next, we have Dr. OlaWale and his wife, nurse, I didn't try to pronounce your name with you, so now I've just got to go into it. Nurse Tiawo, or Nurse Tia, Ajao. They lead Baby Health Events, a health communications initiative serving families in Baltimore, the DMV, and beyond. Hello Baby believes in educating the whole village, empowering community doulas, and advocating for professional doula services as a public health intervention. With 12 years of teamwork as a married couple, Wale and Tia both are equipped as Lamaze certified childbirth educators and as trained doulas, creating solutions for both families of color and of culture. Wale and Tia also draw on their background as a nurse-doctor couple with both local and international experience. Last but not least, we have Jacqueline Lambert, who is a grassroots organizer who serves her community in different aspects of birth work as a childbirth educator, a Rose breastfeeding community transformer, a doula, a certified lactation counselor. Jackie works for Delta Health Alliance Healthy Start program as a breastfeeding coordinator. She is also the project lead for the Let's Talk Baby Café, which is a free virtual drop-in site for pregnant and breastfeeding families to receive education, support, and assistance on their breastfeeding journeys. Jackie has been working with expectant mothers and families for over 14 years, and her goal is to empower expectant mothers and families to give them the necessary tools to make an informed decision concerning their infant feeding goals. Jackie has been instrumental in helping bring together the community around breastfeeding and seeks now to help establish baby-friendly businesses in her community. That is a lot of words from me, and I am going to pass it off to Dr. J to please share your voice and let us know more about what it is that you're up to.
Hey everyone, thank you so much for having me here. It's truly an honor, and I've had the privilege of working in some degree or to some degree with Miss Jacqueline, with Nurse Tia and Dr. Wale, and they are doing tremendous things in their communities and are just absolutely amazing individuals. As a pelvic floor therapist, I often like to start off by just telling people what pelvic floor therapy is, because the vast majority of people have no clue. And I think that's why we are a very underutilized clinical niche for the pregnant and postpartum population. So I'm going to share a few stats with you briefly. During pregnancy, the average reported prevalence of pregnancy-related pelvic girdle pain, which is going to be your SI joint pain, your pubic symphysis dysfunction, your lower back pain, can range anywhere from 45 to 80, 90%. And more often than not, we tend to find women with a combination of these things versus just one or the other. And one of the things that's very interesting, and it came out, it's come out in research before, but a recent research article came out last year showed that depression, postpartum depression was associated with higher levels or, increased incidences of pelvic girdle pain. And so that's something that we need to be mindful of. And one of the reasons why we need to screen, make sure that people understand what's going on within their body and so on. Postpartum depression was also associated with a higher incidence of urinary incontinence, another thing that occurs with women sometimes during pregnancy, but most definitely afterwards. And other considerations need to be given for things like pelvic organ prolapse, just pain in general. I think most people just assume that pregnancy is a time where we hurt for 10 months. And somehow magically or another that those pains will go away afterwards. And for one, I like to tell people you don't need to be in pain. There are resources, there's help for that. But also the mere fact that after pregnancy, women aren't prepared for that. Women aren't prepared for, adapting to the changes that their body now has to go through. It took 10 months to go through changes. And now that you've had the baby, it doesn't automatically revert back to where it was 10 months prior. Right? We have to be cognizant of that within our society. And so one of the things that we do as pelvic floor therapists is really assessing women, helping them to understand their bodies. I believe strongly in education. And I think that, learning and knowing is half the battle, right? But helping them to understand their bodies better, helping them to be better equipped with dealing with the issues that may present themselves, not just from a clinical perspective. So not just coming into the office, the clinic, wherever have you, and just treating it there, but learning how to adapt then with normal day-to-day function, because the reality is they're up and about, they're running around behind, if not the newborn, then the toddlers or the older kids, and they've got things to do. They've got to return back to work, and we've got to make sure that they can function appropriately. Unfortunately, pelvic floor therapy tends to be underutilized for a number of reasons. Socioeconomic status. A lot of people may not be able to afford. A lot of pelvic floor therapists, myself included, tend to be out of network with insurance providers because in the insurance model, we are not allowed the time. We can't treat people. I usually will have people in my office for an evaluation for 90 minutes. There is nowhere that I will get that working in an insurance model, which is unfortunate, because when a mom comes in and she needs time to cry and she needs somebody to hold space for her, that's what I do. And that's what my colleagues do as well. And so it's trying to find ways to work around that so that we can still provide quality care to those who may be challenged from a financial aspect. In a lot of places, there are no pelvic floor therapists. So there are many people living in geographic locations where they don't even have a pelvic floor therapist. I know in the state of Georgia, for example, one of the stats that I continue to find amazing is that we have 76 counties that don't even have an OBGYN. So let alone, they don't have any pelvic floor therapists there either, and in many more. And I think that those things are very important to note. The other thing that we also have to be mindful of is people just don't know what they don't know. So they don't know that there's something out there that can better help them. So what I did during the pandemic was I started doing postpartum virtual assessments. I'd already been doing them. I'd already been virtual well before COVID, and utilizing telehealth as a part of my practice, but utilizing these assessments as a way to screen women, not just for pelvic floor therapy, but what I found was interesting was the fact that even with these screens, I was able to direct a lot of women to lactation consultants. I was able to direct them to gynecologists if further postpartum follow-up was needed, if there was more going on that needed to be addressed. So whatever specialist they needed at the time, maternal mental health and so on, I was able through these screens to also be able to determine that and get them the help they needed, as well as if they had pelvic floor issues, we could go ahead and determine, you know what, we need to continue to work on this. You would benefit from this. Or, you know, whether they wanted to continue virtual at that point in time, whether they were local enough to come into our office, or if we needed to refer them to someone else who might have been a little bit closer. And so we also worked on doing a lot of workshops. And some of the common workshops we did, we're talking about pelvic organ prolapse after pregnancy. We had a workshop on pelvic girdle pain and pubic symphysis dysfunction and managing that, which was also coincided with an online program that we created for individuals dealing with this. We talked about cesarean birth recovery, oftentimes another thing that women are not often equipped to handle because it's assumed, okay, you have the baby, we have a cesarean, we get the stitches, and we just go on with life. And oftentimes women may have dissociation issues, so they do not acknowledge their body below the incision. They may have, you know, feelings associated with trauma, associated with, you know, somehow low self-worth and low self-esteem because in their mind, they have somehow failed as a parent because the cesarean route was not what they wanted. And so now we go into some of the mental health issues that can come about as a result of that. And also just healing, sensory issues, neurologic issues, and so on that may come about as a result of a cesarean scar, making mobility very difficult, making future pregnancies very difficult, scar tissue, and so on. So we talked a lot about that and also had another program, online program associated with that, so that for individuals who, you know, couldn't afford care, we could just say, here's our online program, you know, you can go ahead and take that as well. And then we talked about healing after birth in general to give women a better idea of some of the things that they may encounter during that time. How to best deal with them, what they need to know, what are some red flags, when to come into a clinician, and so on. So
it looks as though Dr.
Okay, it's not just me. As for everyone.
That easily access that.
Oh.
Dr. J, you froze for just a moment. So we missed, I think, the last maybe sentence and a half, something about accessing that.
Are you able to hear me now? I apologize. Yes. Okay, we've had rain here as a result of you know, the bad weather and stuff, so I apologize for that. What I was saying in conclusion was that, you know, as a result of this grant, we were able to offer these screens at a rate of 60% less than what we would normally charge for anybody coming into our office or anybody doing a virtual assessment. So it was an easy way to kind of knock out that cost factor that a lot of people have difficulty with, to get them in and say, you know, here are some resources, here is at least a start, you know, that we can get you what you need, and then continue to go from there. And then being also able to offer the workshop so that people had access to those things as well.
Thank you. I was listening this morning to the panel of men and male engagement, and at least one of the men was talking about how, well, you know, of course my wife knew what was going on, and I kept on thinking to myself, actually, no. Most women I know, especially with their first baby, we have no idea what's going on. There's a lot of assumptions that people know a lot more than they do, especially around pelvic floor health. So the idea of even saying, hey, it's not normal to be in pain is kind of a revolutionary concept. So thank you. Tia and Wale.
Absolutely.
Hello, I'm Tia. And we work together on Hello Baby events. A little bit about us. We started back maybe as early as 2013 with, we actually got a small grant where we were able to do interventions for baby showers. And so we would actually go into the homes of families in our city, we're here in Baltimore, and begin actually engaging in their private baby event. And most of the time, you know, if you know anything about the baby shower, especially in African-American culture, it's a moment, an opportunity for loved ones to come, whether family members or friends or neighbors. You all gather into a home and you do funny and silly things just to have laughs and occupy the time. But of course, everyone is there to see how they can, to well wish the family and see how that they can support through gifts, through money, and so forth. So the intervention gave us the opportunity to kind of take that game section of most baby showers and turn it into a learning opportunity. And so we began to create our own strategic games that pulled on true childbirth education. And Noelle will speak a little bit more of it because he kind of pushed us in that direction. But we became certified childbirth educators through Lamaze so that we can really provide real childbirth education for the whole village, right? Because as we always note with these baby showers and events, is that everybody who matters to that family tends to show up that day. And everybody has in their mind and their heart how they would like to be able to be a blessing to that family or to see how can we contribute, what's our role to play. And so we found ourselves then using that opportunity even more strategically, specifically for the postpartum season and helping families to know there's a lot to do in prenatal. We want a crib, we want a bassinet, but there's a whole lot more happening in postpartum where you can get engaged. What do you want to add?
Yes. So I have a master's in producing for film and video, and I'm usually the person in charge of our game nights. So when she came to me with the fact that she was doing baby showers, I was like, oh, let's do this creative thing or that creative thing. So when what the light bulb moment for us was when we looked at Cross and we saw that everybody there, this was the last time she would see, this is the last time that the Burton family will see all these people in one roof, under one roof, before she gives birth. Like, it's very unlikely that all these people, her family, her colleagues at work, her neighbors, people who have traveled from all over the place, it's unlikely that all these people will be in the same place before she gives birth. So we started to see it as a missed opportunity to share a lot of very, very, very important information. I think, like Dr. Martin said, we don't know what we don't know. And what I've noticed is, as far as natural birth is concerned, there's a lot of misinformation out there. There's a lot of negative branding. And that is the first step, at the very least, if they can live with the notion that childbirth is a natural process and that doulas are this amazing magic, from the heavens, if we can at least just put that there, it would be wonderful. So it was a no-brainer to follow her to do the Lamaze training, which helped us to really appreciate these concepts, because I didn't understand. I mean, I went to med school, and while in med school, I never saw pregnancy as this natural process. I just saw it as this medical condition to be medicated away. So the Lamaze training was where I first started really looking at pregnancy and childbirth as this natural process that, people have been doing for ages, without too much intervention. So one of the other things we do at the baby showers is to give the family the opportunity to, it's kind of like a registry. You know how we have baby registries for gifts? So we try to create kind of like a registry for postpartum visits. So we employ, because the tradition is when a mother gives birth, everybody just visits her immediately afterwards. They don't care what her condition is. Everybody visits at the same time and then leaves. We try to create a registry so that people can actually stagger their visits. Like, deliberately don't visit her the day after. Choose a date on the clock when you will visit, so that we spread out all that love. and reduce the likelihood of overwhelming, the birthing family. So yeah, that was what we hoped to do before the pandemic hit. So we had to change tactic, and I'll hand it over back to Tia.
So I think before, even slightly before the pandemic, a little bit not before, I think it was 2019, we found ourselves, although I had gotten trained as a doula in my nursing school program about 7 years ago, we found ourselves back in the training for doulas. So we finished the Maz, and it was like, hey, let's try this doula training thing. We both did that together. And I think it was truly an aha moment, not only for him being a dad, as a doulad, as they say now, but personally too, because I had been in the perinatal nursing field for a while at the hospital, and had been involved as a lead nurse, and I had started to see that medicalization that he is really very familiar about. And so it was really transformative for us to take that training and to really realize that the role of the doula is extremely powerful in the community. So when the pandemic hit, of course, we all remember how fear-driven the experience was for so many people. And when people found out they were pregnant, they began to be extremely afraid about engaging in the hospital setting. I mean, rightly so, because most hospitals were full packed with COVID victims that were fighting for their lives. And so healthy people was very less likely to want to be in a sick environment like that. So there was a lot of fear. And interestingly, at the time I was working at a birthing center, and we started getting all the calls at the birthing center, regardless of the risk level of the client. And so, we have to be very careful, because there is a real issue when you have someone who is high risk and has true medical needs. How do you reach out to that person and make sure that they're engaged in their care when they're really afraid to even go out of their home to their medical appointment? And so that's how this particular telehealth access grant empowered us, because now, as I like to describe, we were able to take the doulas in our community, because we were able, after getting our own training, to kind of stand up and say, we're doula advocates. We have so many community doulas in our little hub, and how can we advocate for those community doulas? And so here we were with this grant. We were able to kind of give small portions of those grants to community doulas right here in our vicinity. Specifically, one group they called the Safe Sisters. And 7 Black women who are all, actually, a lot of them come from public health, medicine, nursing. There's a slew of things they do, but they give back through their doula service. And so we got them together along with a couple of others, and we sent them out, I like to say, similar to drones. The drones can find their ways into nooks and crannies that everybody else can't make their way into. And that's what I really felt that these doulas were for these families who maybe would not have even considered looking for a doula at the time, were suddenly linked up with a doula to walk them through, answer their question, point them to evidence-based information, be their virtual doula in the hospital. Some actually were able to go in person to support. And so it was tremendously powerful and very, it was very strategic to be able to do something like that. In addition, we were able as educators to offer more online virtual classes. Specifically for that cohort, they were able to come in, get their childbirth education, get all their questions answered. We also got involved with the ACTT facilitator program. They actually are really vigorous about their birth advocacy efforts. So we got involved with that. And then additionally, we have a professional who's actually certified when it comes to perinatal mood disorders. And so we were able also to really have her do like a full webinar, I mean, from A to Z, about postpartum concerns, so that every single one of the family people who were involved could benefit from that.
And to summarize, basically, we found doulas who wanted to give back, and were able to subsidize their giving back. But in addition to that, we gave the clients access to advocacy training, such that because one of the most important roles of a doula for me is the fact that they can advocate for their clients. I know that they do other things like coach, cheerleading, and pain relief and all that stuff, but the advocacy part is one that I always emphasize. So yes, they had the doulas to help with, but this case was perinatal. I mean, prenatal. So there was a chance they were not going to get the same doula as their advocates, but we had the advocacy training. The doulas also attended mostly the advocacy training. It's basically a training where the client learns to advocate for themselves. Just be a bit, speak for yourself without turning it into a war zone. And so yeah, there was that, and then we also were able to do the regular childbirth education. And I'm happy to say I was able to, my role, my unique role was talking to the dad, kind of giving them an anchor, a better anchor for the whole experience, because what I've noticed is dads tend to feel left out. Like before Lamaze, I was completely clueless about how to be a support for my wife when she was pregnant. The traditional view is men are not usually involved with these things. We just pace around the waiting room and stuff. But being able to anchor the dads and let them know, okay, no, your role is really, really important. That was one area where I'm happy to have played a unique role. So yeah, thanks for letting me share.
Thank you.
That sounds amazing. I love how you are involved in both the clinical support through the advocacy for doulas, but also the idea of involving everyone's friends and loved ones at a baby shower and helping the community know how they can be involved is so helpful for those who want to be supportive but have no idea what's going on or how they can possibly be supportive. Just the idea of you giving new parents breathing space and not having all of their loved ones descend at the same moment even is fantastic. Jackie, please tell us more about your work in this space.
Oh my goodness. Thank you, first of all, for having me. Dr. J, Nurse Tia, Dr. Wally. Oh my goodness, y'all are doing amazing work. I do have just a few slides. I want to kind of like bring a picture to what we're doing. So let's see if I can get it going. Okay. So, of course, I am with the Baby Cafe. I use the Baby Cafe model. It's called Let's Talk. It is an online platform that provides pregnancy, birth, infant feeding, and parenting services for mothers and their families. Our aim is definitely to reduce those barriers for maternal service, especially during COVID and beyond. So I wanted to give a picture of what we were before COVID. This was our setting. This was about the number of people we can hold in one setting. It was good. It was good. I miss our moms. Of course, all these babies have delivered. Some moms are on their second babies, but we provided mostly in-person services, which when COVID came, caused us to shift and respond to the urgent needs of the mothers and families trying to navigate new ways of receiving care. And of course, we all know this happened, and it caused that fear that someone spoke of, that panicking. Families didn't know exactly what to do. So we faced that challenge of providing pregnancy, birth, and infant feeding and parenting services to our families, especially during a time where everything was closed down in our area. We're in a rural area. We hear about anything everything shuts down. So imagine a global pandemic that causes everything to shut down. But our response was simple. We with the telehealth access funding, we were able to adopt a fully remote services using the Zoom platform to host these virtual meetings. At that time, no other baby cafe was doing that. And so we were able to provide these services fully, and it became a great success. We experienced over a 400% increase for request of our services. We went from what you saw prior to actually being able to serve an average of 20 to 50 people virtually a week. This is how it looks weekly. We're able to provide this not only for our families, but also for those community organizations who were working with some of these families. We were able to engage them, offer breastfeeding support. Yeah, we were even able to offer that breastfeeding support to the families. You would think moms would have been shy about talking, but no, this platform gave them, I don't know, gave them boldness. They were able to talk about the things that hindered them. They had their family members with them. They had mothers, their mothers. They had their fathers, their significant others. Everyone was right there with them. And we provided them with support on how to navigate through COVID. It was a hard time of what to expect for going in the hospital while pregnant, what to expect while breastfeeding. And we use this platform also to allow organizations to come in to share their resources with the families. How can families still access services? So we use this one platform to reach families and everyone else that was involved with the families to continue offering them the services that they need. And so our services, we were able to support those breastfeeding moms with a specific priority on rural families serving in the underserved communities. And so by offering our services online, the Baby Cafe was able to provide support to all families, no matter what their concerns were. So we know initially our Baby Cafe was started just to offer breastfeeding education and support, but we had to think beyond because families was dealing with issues other than just breastfeeding. You know, we were thinking about the families who may now need more education about postpartum depression, who may need education about how to navigate even if there's domestic violence. When we were in person, we were able to keep that socialization going on, and we didn't want to lose that through a virtual platform. So we allowed this to still be a space where we can reach all, but we wanted mothers to know with our supporting of equity, who can they call on? So not only in addition to the Baby Cafe, we were able to create a platform called LOCS, LOCS, LOCS Task Force, which is lactafists of color serving, and for lactation providers of color to be recognized and introduced to the greater healthcare providers. So we wanted the healthcare providers, we wanted families to know who else is in the area serving that can actually give them the support that they need. When you think about the Delta, our counties are spread so far apart. So how can moms get the support that they need when I'm probably 2 hours away from them, but there's somebody else in the community that can reach them? So we wanted to give a voice to those lactavists of color who can also serve the families as well and use this platform to reach out to them. So this was an additional bonus to the Baby Cafe where mothers could learn about and be referred to compassionate lactation providers connected with the hospitals and clinics in their area, and addressing the challenges of accessible and equitable care. And so our short-term service, defining our success. This is a picture. This is my grandbaby here, my first grandbaby. We got a call. Mom was so upset that you can see she was just a few hours old. They then put her skin to skin, and she was upset, and she wanted, what can you do? So being who I am, that activist, that advocacy stepped in, and I drove there. And I wanted to know why she didn't get that. So it's so important for me to advocate for all families so that our providers can be knowledgeable of what how skin to skin is so important, and how spending that time with mom is very important. So we measuring our short-term success by the number of mothers and families who actually attend the virtual meetings, but the long-term success is how defined by how many providers and practitioners are offering these free services to our rural mothers. So what I do, I use this platform to allow providers to come in. So I've networked with some providers who I asked to let them come in to speak and talk about what the best practices in the hospital. And so that moms don't have to be intimidated to know that this is a part of the process, and what can we expect now during this time. So we get, that's one of those things that we're still working in a lot of our counties, trying to bring forth that. So our baby cafe look a little different from other cafes in the essence of we're doing a lot to meet moms a whole parenting goal, not just breastfeeding, but all of her parenting issues on her parenting journey, and what's going on with her childbirth, and how she can get all the information she needs before baby even comes. So we're a little different, but we hope to provide continuous support and education and information to our families and to our lactation care providers who feel supported and empowered in their birth work and their parenting journey. So we use this platform. It has been used for a wide range of services. And I'm so thrilled that we have an opportunity in this little part to play inside of the birth work that we do, because here, even knowing that we do have doulas is not readily accepted here. But let's talk Baby Cafe is trying to change the dynamics of things. We're trying to work in a way that people can know who we are, what we do, and empower our parents as well, but also using it now to empower those who do the work to continue on their journeys. So that's about all that I have about the little work that we're doing. I'm just so grateful to be a part of working with families to help empower them on their infant feeding journeys, to give them all the knowledge, that they need to make an informed decision, but also being able to empower other lactation care providers that in the work that they do as well.
That is an incredible story, how much you grew. And as much as COVID is obviously a terrible tragedy, I am so inspired by the increased reach that a lot of programs have gotten, especially in rural areas. Being able to use Zoom, as much as it fatigues a lot of us, it is really of great benefit in many ways. So all of you obviously play a huge role in educating providers, pregnant people, families, everyone touched by the maternal health world. I'm curious, how do people find out about your programs? You're clearly very proactive in terms of reaching out. And I'd like to start with you, Dr. J, especially because you have what's almost a niche role in the physical therapy element of pelvic floor treatment that a lot of people don't even know is a thing. I'm curious both how they find you, but also are you able to provide services virtually given the COVID environment, which unfortunately not past tense yet?
Yeah, that's a really awesome question. I have been very intentional about networking within the local area whether it, the birth providers, so from the medical providers, the doctors, the OBGYNs going into their practices, talking to their front desk, talking to their, the office administrators and so on, as well as networking with a lot of the other birth professionals, the doulas. I'm also a doula myself. So networking with the doulas, the midwives, lactation consultants, chiropractors, acupuncturists, you name it, whoever is in that space, so that they are aware, educating them about what I do, utilizing them as resources also for my clients. Because like I said, when I see clients, oftentimes it may not be, that they only need me, they may need other resources as well. So having those people within my own community that I can say, hey, go see this person. And that has worked out really well. I've been online well prior to COVID. I was actually seeing clients online, because I do see a lot of clients outside the country as well, where a lot of people, even prior to the pandemic, had issues with access to care and with access to pelvic floor therapy. And so for me, it was a natural transition, starting to utilize the platform for pelvic health. It was, and doing the screens, which are super easy, and just, holding workshops and things of that sort. I feel like in a way, COVID did have some positives in that it allowed us to step outside the box, because we were content where we were. Right. And, sometimes you need something to kind of agitate life a little bit, just to kind of make you do something a little bit different. And that's what it did. But we were comfortable. And what we didn't realize was that, what a lot of people didn't realize was that, we were shortchanging so many people. We were able to access people in our immediate areas. But look now at the, since a lot more people have been utilizing virtual resources, how many more people have access? And, and that's been great. I also utilize social media quite a bit. So Instagram more so than Facebook, but I'm on social media. I do a lot of education there as well. So educating with regular posts, but also if there is anything that, I've got going on, promoting it there so that people can see it, and kind of just meeting people where they're at, because that's where I find a lot of people. I might find them on Facebook, find them in the community. So just kind of having a mix of different opportunities to connect with people.
I guess I'll stick with our previous order. Tia and Wale, how do people find out about your services? And are you doing virtual parties with folks, birth shower or baby showers? That's the word I'm looking for. Is that a virtual thing, or is that on pause for now?
It's on pause for now. Yeah, we haven't really been doing the physical showers. Most of our outreaches have been virtual, especially the childbirth education and doula advocacy.
And like Dr. J was just saying, social media has been tremendous, particularly, it's like you said, Instagram has been really good for it. I think some groups on Facebook. So for example, like, I've decided now to just be strictly an independent consultant and an entrepreneur, which allows freedom for a cloud lead to say, hey, I have somebody maybe 30 minutes away who's engorged and who needs a lot of help. Could you please fit her into your schedule? And I can decide as a birth worker whether I'm going to have them pay out of pocket, whether I'm going to give them some sort of sliding scale opportunity so that they can access that care, or whether to send them to another community agency that's taking insurance. And so being able to work more in the community and literally, for me, it's been leaving the hospital and the institutions and taking that knowledge to the community right where they're at, just like Dr. J had said. Same thing with doula work. Most of my clients have all come from Instagram. And I think it's very important, because I know OlaWale talks all about branding so much, because people cannot spend money on something they don't even understand. For example, if they see the $1,500 SNU bassinet, they know what that does, and so they might not understand what a doula does and how that having a doula may be more worth the funds of an investment of the funds. And so teaching people what we do and who we are has been the biggest piece, because if we can get it into their minds, the importance and significance of a doula, of a lactation consultant, you know, of public health therapy, and understanding why it is that important, then people will put that value on it as well. That's it.
Jackie, you went from having a small group that we could see in a room to, I'm going to say tripling, but probably more than tripling the number of people that were coming out to the Baby Cafe services. How did that happen? Where did they come from? And a question that just came in through chat was also whether or not you have any privacy concerns, if you have to worry about something like HIPAA compliance when you're doing your virtual cafes.
Okay, so where did the people come from? Well, here, one thing we can do, you know, Instagram, social media, Facebook, all of those things, but we actually start holding community drive-throughs where we get a bunch of vendors together and we sit out and we hand out information as they drive through. So that has been a big part. We do a lot of that monthly. And so connecting with those same resources that we knew of before COVID, calling them, letting them know that we have a virtual platform. If they have families who need it, send them to the platform. And then also, like I said, having those community organizations on as well to represent and let them know what resources they have and how they can serve them. So it was connecting with the people we already know, holding community drive-throughs, handing out brochures, having pamphlets made, things like that, and people come. I think it's a lot of not having anything to do, you know, and it keeps the anxiety level down. You can tune in for an hour, you can talk about, ask questions, and also we have presentations prepared for the family so that if there are no questions and to get the questions moving, we do have those slides available that we're actually showing. And so we have topics that we address. With HIPAA, one thing that I did do, I have a consent form that I actually can text right away that they can sign, you know, and then send back to me. Sometimes because there are so many people on, but then if there's a mom who needs one-on-one, we immediately do a one-on-one session. We'll do FaceTime. We do on Google Duo, wherever there's a video platform, I try to be accessible to our families and working with them because sometimes internet is a problem here, you know. Families may not even be able to afford to have a data plan where they have minutes. So being able to be flexible enough to work with them, and then now trying to find services that can give them a phone for things like that or make it accessible for them. So I hope I answered the question.
I think you did, and I have a follow-up question that's
Okay.
going to totally reveal my ignorance because I am an urban person. I've lived in Washington, D.C., I've lived in New York, I've lived now in Durham, which is not quite as urban compared to those two places. The idea of a drive-through event, was that normal before COVID, or is that a rural thing where people did that anyway?
No, it was not normal. It was not normal. It was normal to go to like a resource fair or a health fair, but it was not normal so we changed the dynamics of it. We couldn't be in buildings with everyone. We had to be spaced apart. And so outside was just the best thing. We didn't have to interact or touch with the families. We went to the car, gave them the information. Of course, if someone had questions, we answered their questions right then. We gave them the information to join us virtually so that they can actually get more in depth with their answers that they need. So, but it was not a normal thing.
No, I love it. I saw some protests last summer also that were all conducted in vehicles for the same reason. But I just love the creativity, the human creativity that's come out of this pandemic. For all of the terror from it, there's been some wonderful, pivots and creativity. Like Dr. J said, we had to shake out of the boxes we were so comfortable in. There is a follow-up question as to whether or not the cafe is free or how you are paid.
No, it is free. The cafes have always been like a drop-in site where moms can just come in, get the information that they need. And so now by it being virtually, it is free. It's still free. It doesn't change. And we just do it. There's no fee associated with it, none for me or anything. We just do it.
I love it. I'm curious, all of you are known to UNC and MHLIC, like I said, because of the MTAP project. And so you were funded specifically because of COVID to reach people virtually. What, in my dream world, let's pretend that tomorrow COVID was over. I don't even know what that's ever gonna look like, but should that happen, what are the elements of the virtual work that you've been doing that you think you might keep, and what are perhaps the ones you are just really eager to never see again?
I don't know that there's anything that I would discard. I think the beauty of what I've been able to do in accessing persons who are in more rural communities, outside of my immediate vicinity, outside of the state, outside of the country, has been very powerful, because they otherwise would not have had that access. And I think that that's definitely something to stay. I do miss the interaction, though. I do miss the human interaction. I'm excited for, adding more in-person events so that we can interact, we can connect, but I don't think that I would change the virtual component.
I think I'm one of the few people who actually prefers virtual to in-person teaching, just generally speaking, across board, because you can reach more people and you can have a more controlled class. Also, you can share examples of what you're teaching more easily, because everybody has a device that can see your slides, very closely. Can hear you in their ear. You can hear them in your ear if you want to, and mute accordingly. So I don't see anything that's going to stop, but we see, in addition to all the virtual stuff, some in-person meeting for reinforcement, and it's better to see people in person, to get that true connection.
And just to add kind of a little bit about on the prenatal side, when you have office visits and things, and you might wake up one day just like, I have an appointment at 1 o'clock, but I don't really see myself getting out of bed. It could just be nausea that day, or maybe just couldn't find childcare, you weren't figuring that part out. So telehealth has broken down barriers. I do lactation at the office, and let's say it starts storming, they can decide to change their in-person visit into a telehealth appointment so that they don't have to bring the baby out into the rain and stuff. So I just think it's revolutionary. I don't think we would have ever in our wildest imagination thought we'll be here today, but we take the good things with someone I love dearly says, you eat the fish and spit out the bones. So we got lots of juicy fish with COVID.
Yeah, I, like everyone has said, before being in person, I could only reach those people that lived in that town that decided to come. Some didn't have transportation and didn't have childcare ever spoken. But now I'm reaching people throughout the whole state, that otherwise I would have never known, never been able to assist. And so I'm thinking I'm staying virtual. I think someone asked me a question. I think that may have been Dr. J. Do you think about going into other countries? Do you think it would go there? Now my mind has went there. So I think we can actually stay virtually just to be able to assist those families who may be ashamed to even go out and get help. People face all types of barriers, and knowing that I can just get on a call with someone and that can help, So it has been a blessing. As bad as it has been bad, it has been a blessing as well to still be able to serve families.
I gotta say, I did not expect 100% pro virtual. I'm glad to hear it. So we're coming close to the end of our time. And of course, I saved the biggest question for last, which is the audience for this symposium is extraordinarily broad. It's essentially anyone with an interest in maternal health. They could be students, researchers, clinicians, which includes all forms of birth workers. And each of you is passionate about maternal health and education. If there is one message you want them to take away, no matter who they are, because they could be anyone, they could be the birthing people themselves, support for them, what would you like folks to take away today? I'm not going to call on you. You can unmute and go for it as you see fit.
Women don't have to be in pain during pregnancy. I will echo that from now until the birds come home. They don't have to be in pain. It does not have to be miserable. And to just continue the narrative that, oh, this is just what it is, or this is normal. I think we really need to start dispelling those myths. And we need to stop telling people that this is what it's going to be for them. And, oh, well, after you have that baby, that's just par for the course. You're going to be wetting your pants till the end. I think we really need to stop and recognize that there is help out there, that a lot of the issues that women and birthing persons suffer, they don't need to. It is addressable. And not surgically, but it is easily addressable, and the research points to it. So if we need to talk evidence-based, we've got that too. The research points to it. There are many clinicians. So if you are a clinician yourself, connect with other clinicians that can help spread that impact, so that you're helping more people in more ways. Because if somebody's coming to me and maybe they don't need me, but they need lactation assistance, I can go ahead and refer them to a lactation consultant. I've now been able to help that person. I might not have physically done anything, but I've been able to impact their care. And we keep that going. I think it's so important to just not kind of, wallow in our own little spaces, but be able to kind of branch out and spread the love a little bit.
Thank you. That is so important. There's this idea out there that, postpartum depression is just a thing and just women are sad, as opposed to women are uncomfortable, don't have to be uncomfortable, and maybe these things are connected and addressable. Fantastic. Tia and Wale, you've got the world in front of you. What do you want the world to know?
Okay, first of all, a huge chunk of the information that can change the world in this field, that can really improve birth outcomes, can be learned, can be taught virtually. There's a lot of stuff we can teach virtually. So let's go out of our way to spread the good word, whatever it is. And on my end, it's doulas. I can't stop talking about doulas, so we can share a lot of information virtually. So now we have this tool. Let's take it to overdrive.
And just to add to that, I would say, including with doulas, that we should ask questions. It's easy to keep shut and allow the things to happen to us and just quietly let it happen. But when we start to ask questions and demand an answer, you begin to see a change even in a clinical setting. They're asking too many questions, and now they also want to provide good care as well. And knowing that you're asking questions helps them to realize, you want to be a real true part of your care. You really do want to be an informed and co-decision maker. And so allow yourself to be that. It can be as simple as why are we doing that? Or what can we do instead? Keep it simple, but ask questions.
Thank you. We don't have to be in pain. We can be healthy and happy. We can ask questions, advocate for ourselves, and support doulas and doulads, which is a name. Was that? Yeah, it was doulads was how you said it. I'm going to keep that one in my vocabulary, along with lactifists. So Jackie, no pressure, but you have the final word for what would you like the world to take from this?
I would just say do it. You know, when we started the Baby Cafe, the virtual platform, I didn't know anything. We just did it. And sometimes we plunder on, should I do this? Should I offer this service? Or will I get the support that I need? And I say, just do it. You know, do it if you have to do it afraid. I think about something that I heard over the years that Dr. Bug would say, and it would be, you're the change. You're the change that you've been waiting on. You know, sometimes we look for other people to make the change, but you are the change, you know. Just do it because it's in you to do it.
Thank you all so much. As I predicted, this hour has really flown by. It's been fantastic listening to you. We are looking forward to having this recording on the MHIC website in the future. If anyone in the audience wants to unmute and say something really quickly, we're at time, but I believe there's a break right after this, so we can go over if we need to. Nobody ever wants to speak up, though. It's a scary virtual world. All right, well, thank you all so much. I hope you enjoy the rest of the symposium. Although I know, Dr. J, you're probably busy enough to get back to your clinical schedule. It has been fantastic speaking with you. Hopefully we will work together again in the future. Have a wonderful rest of your day.